On the national scene, Prime Minister Justin Trudeau is urging provincial and territorial leaders to begin negotiating deals now that his government's pharmacare bill is a law.
And our Parliament Hill correspondent Glen McGregor joining us now from the nation's capital. Let's talk about next steps, Glen.
Yeah, next steps are getting the provinces to sign on to the national pharmacare plan. It's really just kind of an idea now. Yes, it has been passed into law, but of course, healthcare and the delivery of healthcare services is exclusively the jurisdiction of the provinces. So in order to get this plan up and running, they need to get each province to sign off on it. Just kind of the same way the federal government did a couple of years ago when it launched a national daycare plan. It had to go to each of the provinces and get them to agree to do it. Now, the rationale for the program, of course, is that Canadians have kind of a patchwork of coverage for prescription drugs. Some people are covered through their employer plan. Most people like those plans. Some people, those at lower incomes or seniors, in some cases students, are covered by provincial plans that don't really go as far as an employer drug plan, but it does give some degree of coverage. The legislation that passed yesterday that became law is kind of a baby step towards a national pharmacare plan in that it only covers diabetes medication and supplies, as well as prescription birth control medications, as well as IUDs. But the government thinks ultimately this is the kind of a building block, and we're going to get to a further place down the line where more and more drugs are covered. Now, the Prime Minister was asked about this today and the challenges of getting the provinces to sign on. He's actually at an international summit in Laos, in Asia. Here's what he had to say very early this morning.
This is a measure moving forward on pharmacare negotiations with the provinces that will help Canadians in their health and help them in their pocketbook. But that's something we need to work on right now. That's something all parliamentarians, if they're listening to the constituents, should be working on. But it's certainly something that my government is going to stay focused on.
Now, the government wants to get these deals all signed by next spring, but they're going to face some resistance from some premiers, particularly in Alberta. Danielle Smith, the premier there, has said she doesn't want to sign on to it. And federally, the federal Conservatives are warning that this is going to be an erosion of people's private health care plans they have through work, and that most people will end up losing benefits if this thing is fully implemented. So this is shaping up, guys, as being a potential election campaign issue. We think, we'll probably be into an election campaign by the spring, if not earlier. And this could be a major issue because the Trudeau government thinks if you get these benefits out to people, they'll start to enjoy it. They say 1 in 5 Canadians doesn't have adequate coverage through either their work plans or through provincial plans. So they think this is going to be a popular program and the voters are going to like it. And they're kind of daring Pierre Poilievre and the Conservatives to say that they're going to take it back if they form government.
When we talk about the ongoing foreign interference inquiry, Bill Blair, the former Minister of Public Safety and Emergency Preparedness, testifying today as well.
Yeah, a lot of the questions at the Commission of Inquiry into Foreign Interference focusing on this gap between the time that CSIS brought a warrant application related to foreign interference to Bill Blair's office, and of course, as the Public Safety Minister, he would have to sign off on it before it went to the federal court, where a judge would ultimately have to approve it. And it took over 54 days from the time that the search warrant application was drafted until Blair signed off on it. There's been testimony this week, including from his former chief of staff, a woman named Zita Astravas, about what the delay was. She didn't really give any kind of clear indication. She noted it was during the pandemic and there was complications because Blair was working out of the Toronto office and had to be briefed in a secure location by CSIS officials about the search warrant because they're very sensitive. They can't possibly be leaked out. It's a high degree of confidentiality that applies to those. Blair didn't really explain either what the delay was. As the first he heard of it, he says, is the day that he signed it. Here's his testimony today.
As I say, when the matter was brought to my attention, I dealt with it very expeditiously and promptly. And at no time did the director of CSIS or the deputy minister or my chief of staff ever suggest to me any concern with this issue of delay or the interval that it took to complete this.
Now, of course, Blair is the former chief of police in Toronto, so he knows the process of applying for warrants. He says he's signed off on many of them himself in his former capacity. He understands you need to do it quickly, but we don't have any explanation of why it took 54 days in order for him to sign off on this after it was first sent to his office. It's all kind of very opaque, and we're going to have to wait and see what the commissioner ultimately says in her final report on this about the delay, whether or not there was any concerns of political interference in that process. Were the Liberals concerned about who might be implicated in this if the warrant was executed and evidence was gathered? We don't know exactly whether it was a wiretap or some kind of electronic surveillance warrant. So we'll see what the Commissioner Marie-Josée Hogue ultimately says and whether or not she thinks this warrant application, guys, was handled correctly.
Indeed, a lot of questions here. Glen McGregor, as always, appreciate it. Thank you.
Thanks.